Hello viewers, I welcome you to Excel Health Arena and still on hormonal methods of family planning. I was about talking on implants. I've talked about injectables, I've talked about oral pills, I've talked about injectables, and now implants. Implants are sticks that are inserted just underneath the skin, beneath the skin. Okay, they are plastic sticks. They contain hormones, the same hormones that are contained in injectables that we use to prevent pregnancy. Also, subdermal implants contain hormones, and so they are sticks that are inserted just underneath the skin. They pull open the skin a little bit. It's about 15 minutes procedure. Pull open the skin, and these sticks are inserted into the space just underneath the skin, and that is where they stay for years, depending on which type. There are those ones that stay there for 5 years. There are those ones that stay there for 3 years. Okay, so they are placed there to prevent pregnancy, and they are 99.95% effective. 99.95% effective. That is almost 100% effective. Almost 100% effective. So there are two types: Norplant 1 and Norplant 2. Norplant 1 contains 6 capsules. 6 capsules are inserted. The skin is cut open, like I said, and 6 plastic capsules are inserted there, and they stay there for 5 years. Effective for 5 years. After 5 years, the woman comes back. The skin is just pure with local infiltration. When we put some local infiltration there, it doesn't make the woman to feel pain. So the skin is cut open a little bit, and of course those things are brought out. And if the woman wants to replace them, they can always put another set in there, and the skin is just, you hardly would you even know that the skin has been cut open before. When you see the skin, the way it is done, it is very, very cosmetic and aesthetic in nature. Afterwards, you look at it, you don't even know that something like that has happened there. So Norplant 1 contains 6 capsules of sticks, works for 5 years, and Norplant 2 contains 2 capsules and it works for 3 years. Okay, then another type of contraceptive, hormonal contraceptive, is the vaginal ring. So vaginal rings contain levonorgestrel, and they've been found also to be very effective. Okay, so the hormone is slowly absorbed through the vaginal mucosa. Okay, and the ring, the woman puts on the ring for 3 weeks within the cycle, after which she can remove it. Of course, after the menstrual flow, then the next cycle comes up, she puts the ring again, and for 3 weeks she wears the ring. Afterwards, she removes it. So during this period, the ring slowly releases hormone levonorgestrel, and this makes the vaginal secretion, to be unconducive for the sperm, and the sperm finds it difficult to, in some cases, sperm are destroyed and their motility and strength is reduced, such that motility and strength are reduced such that the sperm finds it difficult to fertilize an egg. So conclusively, every contraceptive method has its own pros and cons. Whether we like it or not, there is no perfect method anywhere. Okay, so when an individual is to uptake a particular method of contraception, there are things you need to look at to be sure that, yes, this seems to be the best one for me. So there is no, in the context of absoluteness, or how do I put it, there is no method that can be solely absolutely safe for anybody. All of them, they have their own pros and cons. So you weigh the two. That is when you'll be able to know that, okay, yes, I can cope with this. Yes, I don't have this, so this is safe for me. This is not safe for me. Let me not move near this. This is safe for me. Let me use it. And in a way like that, you can be able to make informed choice as far as family planning method uptake is concerned. No one is supposed to force a particular method on you. Our role is to give you updates, give you information, knowledge that you need for you to be able to make an informed decision about the method of family planning that you want to uptake. And at the end of the day, you use it with minimal side effects and you're able to cope with it. If you want to get pregnant, it is easy for you to go back, reverse it so that you can get pregnant. And for those ones that are permanent methods, we are still coming to them. Yes, if it's a permanent method, you won't even think of getting pregnant again. But you are rest assured that you cannot get pregnant again, because that is what you want to achieve and it is easy for you to achieve it. So summarily, family planning is worth it, whether we like it or not. And we've talked about barrier methods, we've talked about hormonal methods. Okay,